talking for 2 hours. That's fantastic.
Oh, okay.
I'll put my phone on silent. Isn't that a great picture of Teresa and I shot over the weekend? It was just kind of fun.
Not yet. But we will be.
The church countdown screen when we're about to live stream the church.
This stuff was here last night. Some of it's updated a little bit.
I drink warm water all the time. Another minute.
All my kids are here. Actually, did those. One for contact. And Dawson got engaged last week while we were having our meeting.
Oh, really?
Yeah.
Congratulations.
Real great.
Yes, yeah. It was great. We love her.
Is that the girl that you were talking about? You got to meet her
Oh, I've known her.
before? Oh,
Yeah,
okay.
I actually knew her before he did, which is kind of funny.
Oh, really?
Yeah, I feel like
All right, I believe that is.
it's the mom vibes.
Yeah, sometimes you see it and you can sense it, right?
Mm-hmm.
That's good.
Wedding probably.
Oh,
I think he's got a busy year. Probably next summer. He has a fellowship from.
It is 8:30, and so I would, let me do my thing, call the meeting to order. Roll call, please.
Mrs. Eichholz,
Here.
Dr. Hooker,
Here.
Mrs. Johnston, Mrs. Lewis,
Here.
Mrs. Singh.
here.
I'd entertain a motion to adopt the agenda.
So moved.
Second.
All those in favor? Aye. I'd also entertain a motion to go into executive session under ORC 121.22G in accordance with ORC 121.22G3 and ORC 121.22G5.
Second.
All those in favor? Aye. If anybody is here already, we're going to executive session. We will be back. Where I have lights, I can't see anything.
Water.
Give Ray a second to get seated.
Amen. Turn on button, please.
All right.
Thanks.
I had it on, ready to go, so.
I went to sleep.
There you go. And then IH board.
All right. We are returning from executive session, and we're going to start a work session where the board members can dialogue between themselves on this issue of school reopening plan. I therefore would yield to Mrs. Lewis. Would you like to start us?
Yes, thank you, Dr. Hucker.
Can you move your mic closer to you, if you don't mind, and get closer to it? Just, it's not carrying.
I guess I'm kind of in between two mics, so that's no problem. I just wanted to start this morning and just talk a little bit before I get into some questions and ideas I have for the board. I just wanted to address some of the concerns that have been raised about experiences that affect children's mental health. And there are lots of experiences that affect children's mental health, whether they be, they get boyfriend or girlfriend breaks up with them, or whether nobody sits with them at the lunch table, or there's a parent's divorce, or they get a bad grade in school, they don't get into the right college, they have to quarantine for COVID, and yes, masks may affect children's mental health. But everything that I've read, that mental health doesn't equate to mental illness. And mental illness can come in many forms: mild, moderate, severe, or terminal. And for those people to equate...
Kim, could you pull your mic down a little bit closer? Nikki's having trouble hearing down here. Thank you. Sorry.
For people in public commentary or discussions at a board to equate some experience, whether it be wearing masks or otherwise, that might affect a child's mental health to terminal mental illness, is denigrating and trivializing the suffering and ultimate death of that child and the children's family of what they're suffering. And I just wanted to say that because I do believe that there are many experiences that affect a child's mental health, but it's very different than mental illness. With that, Dr. Hooker, I'd just like to talk a little bit about some of the things that we've talked about as a board and just kind of open up some discussion about a number of things. As we all know from a scientific standpoint, the best defense to the Delta variant is vaccinations. So with that in mind, I mean, obviously children 12 and under aren't allowed to be vaccinated now, but the children that are over 12 and over, can be vaccinated. And so I do think that, as we think through this over the next few weeks, that we ought to think about, whether or not there are possibilities for those populations that have the ability to get a vaccination, whether there could be exemptions, and administratively how you would be able to deal with that. I don't have the answers. I just think that it's something that, as we continue to discuss various options on a go-forward basis, because this is really just what we're going to start with, I really think that we ought to consider things like that as vaccinations become available, as vaccination clinics happen, and whether or not there is any ability to do any type of exemption, despite the fact that we all know that House Bill, 244, will go into effect on October 13th, but that doesn't mean that prior to October 13th, we couldn't think about those options.
Yeah. Yeah, that's, thank you, Ms. Lewis. Is there anything else that you wanted to say on that?
Not right now. Just
Okay. Can we go all the way down to the other end, Nikki?
So I did, like last time,
And Nikki, I'm going to really ask you to get as close as you can,
sorry.
just because this is being recorded, and I really want people that are at home to be able to hear what you have to say.
Sure. So I did write some of my opinion, and based on what we heard last time and previously through emails and texts and phones that we all have received. So based on that, I just wrote a few things just so that I don't miss out on anything. So first thing that we heard, that we haven't done our homework. So I just want to say is the decision that we made on August 3rd was a very difficult decision for all of us. But we all did our homework. We all did look into a lot of data, and we very carefully considered, after spending a lot of time looking into the advice that American Academy of Pediatrics, Hamilton County Health Department, Ohio Department of Health, Cincinnati Children's Center of Disease Control, and some of our professional experts and are advising to us. So the decision that we made was based on a lot of data, based on which we made a decision. So, and honestly, my decision does not reflect my personal feelings, as I'm not an expert, I'm a parent, but I'm following the expert's advice. I appreciate that you all came forward to share your concerns with us, which are very valuable to us. I have read your emails, I have talked to many of you over the phone, and I understand your frustration and concerns. I hear that you don't want to wear a mask, and I'm with you on some times. I don't want to be wearing a mask either, especially with my glasses when, it just fogs up and it becomes difficult sometimes. But I still wear it because it is important for the safety of myself and people around me. I got vaccinated. I feel privileged, but I have to be mindful of people around me that they are safe too. I could always carry it, so we have to be careful. I admire so many of our healthcare providers who work hard to treat patients while wearing a mask all day to protect themselves and their patients. So, again, as I said before, I'm not an expert with the ability to question the concerns many of you have voiced to us. I know you are here for your kids, and I'm here for the same reason. I do care for your kids. My primary goal is to keep the kids in person in school for as long as possible, as we have learned that kids learn best in the school, in-person learning with their teachers and with their peers. It is really important for them to be here. We cannot do so if students and teachers start getting sick. So that's why I deeply care about our students' mental health. Mental health is definitely an issue we need to collectively address. However, this will be much harder to do with children being pulled out of the classes and back into isolation, which is worse for them. Something that has happened with many of our children in this past year that we all have witnessed. We have to be considerate for all the children, as most are not vaccinated. For example, Blake, she's a student of a district who has a muscular dystrophy, and I'm sure many of you must have seen her video sharing her story. If you haven't, I highly recommend that you see her story. Even with her breathing issues and weaker lungs, she believes in wearing a mask as she knows it protects her and allows her to attend school in person, which is very important to her and all of us. She is a student of her district, and we have to consider. Again, we have proposed the mask policy only for the initial first 4 weeks. We are not saying that it is going to be for the whole school year. It is for the beginning of the school year. And this is because of the surge in the Delta variant we are seeing throughout the country, which is making some kids very sick and in some cases requiring hospitalization. According to the data from US Department of Health and Human Services, the number of children hospitalized with COVID-19 in the United States hit record high, just over 1,900 this Saturday. And schools are just about opening. The number of newly hospitalized COVID-19 patients aged between 18 to 29, 30 to 39, and 40 to 49 has also hit record high this week, according to the data from US Center of Disease Control and Prevention. According to Sally Goose, she is a former president of American Academics of Pediatrics, told a major news channel on Saturday, this is not last year COVID. This one is worse, and our children are the ones that are going to be affected by it the most. Last week, our local hospital partners, TriHealth, had seen Last week they had 30 patients, and now that number has gone up to 55 positive COVID cases. Mercy Health, which is another local organization, has 194 COVID positive cases right now, which has gone up significantly. Cincinnati Children has seen an increased number in outpatients. The number of positive outpatients has increased 3 times compared to mid-June. I have one more that I would like to share. And so, sorry. And the numbers are increasing everywhere. Now about the mask that we are all talking. Based on study done on 1 million children at the Duke School of Medicine, found that vaccine is the most effective way to prevent COVID or its spread. The second most effective way till our kids can get vaccinated is masking. Cincinnati Children, if you go on their website, they will tell you that wearing a mask can prevent 85% of time. It's 85% effective, sorry, I should say that wearing a mask is as effective as you can think of anything else. And I understand that many of you are concerned about how kids will wear it. Again, if you go on their website, Cincinnati Children has done a great job explaining how you can try different masks. It's like one mask does not have to fit everybody. You can, if your kids don't like it, try different masks and see if they will like that. I don't want our students to be pulled out of the school to quarantine when they can get exposed to the virus. Again, this happened quite a lot this past year and was disruptive to students' learning. Wearing a mask for 4 weeks while we are still being in school is better than being forced to quarantine in isolation after COVID exposure. This will also allow our athletes who have worked so hard during the summer to get to play during their tournaments. Once I think we have ensured that there isn't a large initial spike in cases, I'm all for reevaluating a mask mandate and allowing more freedom to our students. Every decision I make, we do listen to medical professionals. We do look into the data. We do get a lot of data from ODH, Health Department, from Mr. Kennedy every week. So we are keeping a close eye on what is happening. As we are listening others, I just want to tell the parents and people who are listening, as we are listening others, we are also listening to you, and we are committed to the safety of your children. Your children's safety and well-being is our biggest priority. So please, 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 bear with us, understand the situations we are in. It is not easy for any of us. We're just trying our best to keep schools open, as most of you all have asked all the time. And that is the most important thing for all of us here on the board too.
Thank you, Nikki. Appreciate it. Elizabeth, like I say, Elizabeth is not here.
It's my middle name. Okay, so I'll be a little bit brief, I think. I still feel very strongly that parents have options here and should have options, especially because right now, our local data, in my mind, does not support a mask mandate. We were super concerned about all of our children all the time, but we only have them, 8 hours a day, 6 hours, whatever the day is. And then as soon as they leave, they take their masks off. So I don't think that we can necessarily equate having masks in school with children being exposed and therefore needing to be quarantined. So I think we all just need to be kind of clear about that and know that we're going to be dealing with those kind of outside influences no matter what we do internally. I think, we've spent now 3 meetings talking about one issue about COVID, and as we all know from last year, the COVID issue is huge, and it's much greater than just the masks. So I'd like to see the board get to talking about actually how we'll handle children coming back to school in all situations, just like kind of we did last year. We had kind of a sliding scale, and we had reporting dates, on a regular basis. We had, we're required to message out when students or teachers test positive, so our parents can see what's happening. If we get back to school and we have, 10 cases in the first week, and we're reporting that out, parents know what's going on, and they can determine for their own child what needs to be happening. The issue that we as a school board need to deal with is the quarantining. We're not a health board. It's unfortunate that our state and our county have kind of put us in the position of thinking we need to be a health board, but we're not. And what we need to really focus on is how do we keep our kids in school, and how do we manage that quarantining situation, given that it's not nearly as straightforward as it was last year. It's confusing. It's, masked versus not masked, unvaccinated versus vaccinated. They're still trying to recommend 3 feet. I think we know with our current situation, we're down one whole school building, so it isn't really possible to keep the 3 feet. And I think our children are ready to be back together. I have always been very impressed with how this district handles and manages the school life of all of our special needs children. And I have no doubt that with care and compassion and focus on the individual student, that our staff will fully protect all of our vulnerable children, because this isn't the only thing that they will be vulnerable with. And I think you all have done an amazing job with that, and I have no doubt you'll continue. What I would like to see is actual metrics about how we will measure. Right now, as it stands, we have a mask mandate. Later in the and rules of order, I'd like to amend at some point the 2-week, 4-week, because what I would like to see is not 4 weeks, but 2 weeks. If we're going to start with masks, then I'd like to see in 2 weeks where we are, and I think the parents would like to see where we are in 2 weeks. But what I'd like to see us do today is talk about what is that number? What are we looking for in 2 weeks? And what will change one direction or the other? And the other question is, if we start the school year in masks, and we have very low numbers right now, that's what I was looking for, Mick, is that Excel.
Do you have can you pull your email up, Mrs. Uncle?
Yeah, I can do that.
I'm sorry, I didn't understand what you
I'm looking for the Excel spreadsheet. I thought it was going to be on here. I'll just pull up my email. But, I don't know where I was going with that. Sorry.
Take your time.
Okay, so right now, we have a mask mandate. Our numbers are super low. Looking at local data, because that's the only thing we can really look at. We can't, we can't decide from some other state somewhere else what to do here in Indian Hill. But if we're where we are right now, what is the number 2 weeks from now that would either go looser on the mask mandate, or where do we go from the mask mandate? What happens if we're all in masks and we have half the students quarantined? What do we do? We really haven't talked with the administration yet about how will we manage that? How many children can you manage on BBA? And is that the plan? So I think those are the things we need to be talking about. Let's assume for the conversation today that we have a mask mandate at least for 2 weeks. And then let's figure out from there all the other things we need to talk about. Are we good with that?
Yeah, I think that makes sense. I think we probably all have some ideas, but, I think that we'll be looking, can you hear me?
Yeah.
But I think we'll be looking at our administrators for further information. Some of the things I don't know that we can actually set a specific metric, but I think things we'll find out in the next few weeks are, hopefully positivity rates and what happens to positivity rates in the county. And I think there are a number of schools that have opened up, and actually large school districts that have opened up mask optional. And I think we'll probably have a lot more information about that by the end of next week, because Mason and Lakota both opened this past week in mask optional. So I think that we'll know what type of quarantine data we'll have with that, and we'll certainly know whether or not our masks are effective. I don't know that I can say what the parameters, but I think all of those things we can look at and make reasoned decisions based on those. And I agree with you, Nancy, and it's kind of why I raised the other point is, are there some other ideas as, like our middle school and high school students, if they are vaccinated, are there ways to handle that from an administrative standpoint that protects also the immunocompromised children that are, able to, and again, I just think that that's something we ought to look at. Unfortunately, I don't think it's just yellow, red, orange like we did last year, which, as you know, we didn't really stick to because...
But we used as a guideline, and it led to discussion.
Right, but we
don't have that this year.
We used it as a guideline, but at the end of the day, it was really what was happening. And we realized last year that even though we said when it's going to be red or purple, we're going to probably go to BVA all the way, we realized that masks worked. So we didn't have to do that. We were able to stay in school 5 days a week. And I do think that's the most important thing, is to try to keep these kids in school 5 days a week. But I do agree that we've got to address this as we get more information. And I'm hopeful that we will have a lot more information in a week or two because of other schools coming back in different ways.
I think that's a really good point both of you are making, is that we need to look at the local surrounding schools. I think that's part of what we're looking at. I think last year we did an amazing job of looking at everything from CDC guidelines to APA guidelines, local data, and personally, I want to see the things falling off. If we look at England had the Delta surge, and within a month, it had started dropping. We may have that. I hope we do. I do think your point on BVA is really important, Nancy, that maybe some dialogue right now from Kirk, some comments from Kirk, because I'm concerned we really don't have BVA as an option right now. And how quickly could we get BVA up if we have to? And I really pray we don't. What is the district's plan for that? Because right now it's not really what we're doing.
If this is a good time.
And if you don't mind, Mike, close to you, because it's really hard.
If this is a good time to start to kind of go through some of the resources we shared with you board members, I think we can address that along with some of the other points that I've heard. I just didn't want to interrupt your statement, Dr. Cook, if you were wanting to.
No, I think I've made my statement, and my repeating everything I said the other day, I don't think is going to add very much. So I really would rather hear from you of what we can do on this and move forward.
So we'll go through the resources here, and I will come back to the notion of a virtual learning option. It is not called BVA this year. That was what we did last year, and we will talk a little bit about that as we go through. And I'm going to go through the resource I shared with all of you. If you would like to move, it's behind you, but you also have it on your computers.
I'm actually just going to look at it on.
It's also a printout
thing here
in your folders. So again, we talked about this at both of our previous meetings. We're making some assumptions here that we want to share. We're going to continue to offer both an in-person option and, for those who are interested, a virtual learning opportunity. Those would be available for students with extenuating circumstances or by request. We'll deal with those on a case-by-case basis, and we'll get more into that in a few moments. All of our typical annual school calendar of activities commenced on August 1st. That is different from last year. We've had several questions from parents about the reopening of schools. All of our activities are back in place. All of our curriculum, programming, gifted would be one example, performances, obviously, activities, clubs, athletics at all levels, field trips, those are just some examples. And so we will work to mitigate with not only masks, but all of the other general safety protocols we've put in place moving forward. But we plan to offer all of those things.
Can I ask a quick question? Does that mean that in the lower schools that the children will still have the plexiglass in between them and their tables and desks, or is that
No,
not?
physical barriers on tables and desks at the primary and elementary are not in place, and we'll come back to that in a moment, if
Okay.
that's okay,
Yeah, that's
as we
fine.
get to
Yeah.
the mitigation strategies.
Just wanted
Okay,
to
because
clarify.
I had the same question related to lunchtime.
Yeah, and if you have questions anytime while I'm presenting,
Yeah,
just
because
stop me.
lunchtime's a big difference because the masks are coming off, so we need to talk about that.
We're going to continue to mitigate the spread of COVID through cleaning and safety protocols. We'll talk some more about that. And again, we're going to continue to monitor and receive local, regional, state, and national data and input from area health partners and government officials to make informed decisions, as we've done for the past year and a half now or more, and many of you have referenced. These are things we look at weekly. I want to thank everyone in the public who has sent us articles, data, and resources, and I would just reiterate that we're already looking at them. There were a number of developments in the summer we went over last time that have been referenced here. House Bill 244, again, for people who are not aware, this was signed by the governor in July. It goes into effect October 13. That language prohibits public schools from mandating vaccines, but not from asking about vaccination, which we'll talk about soon. It prohibits public schools from requirements that discriminate against classifications of students vaccinated or
Kirk,
not.
I just want to clarify one thing. It prohibits any vaccines that are still under EUA, which may
Correct.
change dramatically here in the next week or so with multiple vaccines getting full approval. So just something that I think the audience needs to know and the board needs
Yeah,
to know.
if the FDA were to fully approve the 3 vaccines that are out there for emergency authorized use now, that would change the effect of this law.
Yep.
Senate Bill 209 has been introduced prior to the break. The legislature comes back after September 7th. This is a bill that would prohibit public schools from requiring masks. Again, all of that is up for conjecture at this time. There's no bill. There's no law that says you cannot require masks. CDC guidance, of course, recommends universal indoor masking by all students age 2 and older, staff, teachers, and visitors to K-12 schools, regardless of vaccination status, in their latest opening guidance. ODH guidance is aligned. Hamilton County guidance is aligned to both CDC and ODH language. The Pediatric Association recommends universal masking. Children's locally has also recommended that, along with our Tri-Health partners. Contact tracing is a legal requirement through ODH, through Hamilton County. It's a Class A level reporting requirement, which has the effect of law for us whenever we have suspected contact tracing or cases. And there is a federal order still in effect through the CDC requiring masks for all public transportation passengers on school buses through September 13. That could either be amended, extended, repealed, but we don't know. So it has the effect of law through September 13th for anybody who rides a school bus. We amended the face covering policy in dialogue on August 3rd, and just to review, again, masks would be required inside all school buildings at all times for students, staff, and visitors until September 14th, unless that is amended. Masks could be removed for lunch in the cafeteria while students and staff are eating. Masks could be removed by students and or staff in already approved school activities or events indoors related to the practice or competition times during performing arts and or physical activities such as physical education, choir, gym, dance, and sporting contests. All visitors would be required to comply with the same masking requirements. Federal transportation order, again, as I stated, would require masks for all passengers through September 13th. This was the language that the board discussed on August 13th for amending the face covering policy that was in place and updating the guidelines. Questions about that before I move on?
Well, I do have some concerns of that we're masking, except for now we're going to have no mask in the gym, and we could get a big spread just from that. I have some concerns. The football team is one thing where they're out there on the field in the open. That our policy does not have anything to do with being in the open, outside and all that. But I have some concerns where we have kind of changed our policy to say, we're not gonna require you to wear it in the gym, and as I already mentioned, in the cafeteria, we need plexiglass because we're taking the mask off. Mrs. Lewis, you had a comment?
I think the language is, I think what we tried to do to make the language specific and related to the practice or competition time where you're participating, which is also how we finished second semester last school year and is consistent with that.
That's what I was going to ask, is I understand this is the consistent language that we used at
Last
school,
spring.
last school year.
In the winter.
And, during that period of time, we did not have.
Yeah, but that was not with the Delta variant.
Yeah, as I recall, that when we did it during second semester, we still followed the quarantine rules that were in place, and did, at that point in time, when we moved from first semester to second semester, permitting this type of involvement, did our numbers go way up, do you recall?
No, they did not. In effect, the contact tracing and quarantine is still going to continue. And if you look back at our performing arts and athletic activities throughout the school year last year, we actually had very low contact tracing and quarantine numbers amongst our teams throughout the school year.
I think this is something, and I respect your view on it. I just think that this is something that, as part of our monitoring on a biweekly basis, to the extent that we have something that breaks out in a physical education class or a choir class, that we would know that.
And we did take, Dr. Hooker, if you remember, we did take a pause last year in the winter because we felt like we had to at a certain point in time, and we reviewed it weekly, and I think we could do that again.
Okay.
But in those classrooms, as I understand it, I again apologize, but as I understand it, in those classrooms, we do seek to maintain at least 3 feet of indoor distancing. So we're doing other things in those classrooms when they're masked, when they're unmasked for active participation.
Yes, and I'll continue to go into that, but the idea here is, unlike last year where we had 3 feet or more or 6 feet whenever and wherever possible, and we had students in static positions, our teachers are preparing for a school year this year where students will be wearing masks, but will be much more physically active than they were last year at all levels. I think if you all recall, when we reopened last year, that was something we really emphasized. So again, to fall back to the contact tracing protocols that we'll talk about, the duration with which somebody is in the proximity of less than 3 feet matters. And that's something we'll all monitor on a daily basis. And that's going to help us to mitigate and pay attention to who should be contact traced and who shouldn't. So one of the things that came up, I think I heard Nancy talk about, was a rationale for a biweekly review period for the mask requirement return to school. This is that rationale. We kind of went over some of this on August 3rd again. I think it's come up several times. This would be the rationale for why the board may look at this requirement on a bi-weekly basis. It would allow us to offer consistent in-person learning opportunities. We know, of course, we don't have children under 12 vaccinated. We want to monitor COVID and Delta V caseload trends. We want to get input from stakeholders. We want to make sure, again, that everybody understands we do not have 6 feet of social distance or physical distance across campus. Part of that's due to facilities, part of that's due to enrollment. We have a lot of people last year who chose not to return to school in August, and we stood up a BVA. This year, we expect over 96% of our student population back on campus to start the school year. So we just need to make that very clear. This is a difference in terms of physical distancing and that expectation, which is why we will again fall back to following the ODH guidelines. If somebody was within less than 3 feet for a duration of more than 15 minutes, they could be included in a contact trace situation.
But not quarantine,
Kirk, can I?
They may
Sorry.
not be quarantined. We'll go through some of those scenarios.
Okay.
Okay, I'm sorry about that.
No, it's all right.
That's what I was going to say, it depends on whether they're masked or unmasked.
There's a lot of slides. No, it's all right. We'll come back to it. And we all know that we have the ability to look at these data reports that I send the board weekly and to review this on a bi-weekly basis. I think what we heard from stakeholders in feedback over the last 2 weeks was the perception that 6 weeks or 4 weeks was a long time. So we need to clear that up. So some people have wondered about our partners again, whether they were paying attention over the last year and a half or not. So I thought we'd go back over some of the factors we use to review information. First and foremost, Greg Kesterman, who is the Commissioner of the Hamilton County Public Health, he reports directly to ODH. He gets us information directly from the governor's office. We're on a call with him every single week on Friday mornings. The biggest piece of information that would be available and critical for decision making for school boards would be your own district attendance and quarantine levels. That's his quote about how he thought boards should look at factors for review moving forward. Our Tri-Health partnership, we have a number of doctors who meet and convene weekly, and our point of contact is Dr. Robert Dunham. who talks with us and typically talks about looking at the 7-day moving average of COVID cases among the demographic groups that make up the 0 to 19 age groups by onset date of COVID per 100,000 cases. So let's talk a little more about that. Ideally, if the number were 3 per 100,000 for each of those demographic groups that are broken down, whether it's 5 to 8, 9 to 11, that's what he would suggest you're looking at, and then you could come up with a total every week. He said that would be ideal. Those are the factors that they would recommend you maybe take into account, and again, that has to do with average caseload per 100,000. We get that data every week, and we share that. We can share that.
Just a question. I think that's regional data. Is that right?
We get that regional data
from
here for our
CCFT.
region. We also have a state average caseload rate that we can see on the ODH website, and we can look at the national data on the Mayo Clinic website.
And Nancy, I think you've looked at the same data I have with the Excel spreadsheet. Is it 8 right now? Is that right? In the region?
I'm having trouble pulling it up.
I believe it's
it was
8 right
9.
now for pediatric.
Overall, yes, and overall 16 across the state. But 0 to 19 age group, we can break that down demographically. We've also asked the Ohio Department of Health, and Commissioner Kesterman has asked ODH to start to put on their dashboard the vaccine status for those same demographic age groups so that we can see that and monitor that weekly. That's going through a HIPAA legal review with the government at the state level right now, but we hope to be able to see both of those pieces of data moving forward. I think that will help people to not only feel confident about vaccination percentages amongst children, but also how much caseload is there really out there.
Thank you.
We also talk every Friday with Dr. Stephen Fagans, who represents the Center for Clinical Translational Science and Training Health Collaborative, affectionately known as the Cincy Health Collaborative, and he does speak for pediatricians, and he does give us weekly data on hospitalizations at Children's. So what we talk about each week is vaccine efficacy, approval status for children 12 and under, hospitalizations in the city and the region, positivity rates, R factor, all the data that any of us could try to mine ourselves, we get from the doctor every Friday. Some other factors for review that have come up, again, taking a look at these, and they're not necessarily in a rank order, but I would ask the board members to think about how you would want to dialogue about them in terms of efficacy and importance. Campus numbers and the percent of reported cases among students or staff, whether that's all COVID or Delta V. Again, are we looking for a weekly quarantine impact? We've shared that weekly for the last year. We will continue to do that. Are we looking at the number of 0 to 19-year-olds impacted locally? We will continue to look at zip code numbers each week, and we can report those to you and share those.
Which zip codes are you going to be looking at?
Well, we can look at multiple if you like. We can.
Well, no,
pull
we've
up on the
got
Hamilton
people
County
living in
45243, 45236. I mean, we could look at any.
I think we ought to look at all the ones that encompass our school district.
Well, and I think that's also something that we've done for the last year and a half as we look at contiguous zip codes, contiguous districts every week. You get a report from me about what every district surrounding us is doing.
Wonderful.
We also look at the local vaccination number percentage. We've started to track this whenever we can get it from the county and the state. I think it's very important moving forward that we are looking at vaccine percentages. I mentioned earlier, we believe that we had over 82% of our staff fully vaccinated through our partnerships with Tri-Health or other local providers. That's a really important baseline now for us, and moving forward, we can ask questions about vaccination status. People do not have to provide information, but if they do provide information, we can then update our percentages of numbers, and I think that's very important for the school community to reflect on. Staff, students and families, visitors, anybody. We have a baseline of over 60% of Hamilton County residents. Those are people 12 and over, fully vaccinated as of August 13th, and 60% of Ohio residents fully vaccinated as of August 13th. So we have a baseline again. Should we ask families to share information? We may be able to have much more specific local information that we just don't have today, especially with regards to our own school population, which I'm very interested in. We look at total zip code caseload data. We talked about that. We look at a county positivity percentage every week on Friday. We also know what the state's percentages. We can compare those things. And we know child hospitalization numbers as they are reported every Friday to us by the Health Collaborative. And again, if somebody comes with numbers over the weekend or Monday or Tuesday the following week, I get those every Friday morning.
So at this point, we don't have access to the percentage of our students that have been vaccinated, correct?
We believe we have a baseline percentage based on the number of students we know last spring who went through our vaccine clinics.
Okay.
We are waiting for the county to start sharing by demographic age group vaccine percentages, and that's not posted yet because it's going through an ODH legal review, but they tell us it's coming.
Okay.
We also have the ability to field that question out and hope to collect new information, and if families were willing to share it, we would be able to update our percentages. And I think that that's something I would ask you all to dialogue about. HIPAA allows us to ask questions. We may not get a response.
But we are allowed to ask the parents
Yes.
just to get a feel of how many people are vaccinated in our district, right?
We can ask, we have specific language where we can ask about
Okay.
vaccine status,
Yeah,
and
that
somebody
will
could
help
choose to
us.
reply.
And are you prepared to share that baseline? I may have missed it in your,
Sorry?
are you prepared to share that baseline number? Or,
Oh, right now, we believe it's 60% is what we have to go with until we have more specific information. For the
60% of our
13 and up.
students?
60% of our students, 12 and over.
Okay.
Okay.
I think that's what, that was my same
that's what
question,
I'm
Nancy.
asking.
And again, that may not be 100% accurate. We need to collect information to try to get a more accurate figure.
And we're just waiting for legal approval before we make that survey, or are you planning on getting that survey right away?
We can issue information and put out a survey as soon as the board would give us some authority to go ahead and do that. And I think we should, again, talk about that before we leave here today.
Yeah, I think we should.
So those are some of the factors. These are some of the same factors we looked at last year on a weekly basis. I kind of put them in a rank order, but again, that's for the board to decide. So any questions about that? Because I know, Nancy, you brought up you'd really like us to have a process in place about how we would, or if there's something missing from this that you would want to see beyond what I share in those reports, or if the board members want to talk about which of these factors are more or less a priority before we move on. And these are the things, again, we're recommending we look at specifically on a bi-weekly basis for review purposes.
And I guess my question to the board would be, what are we looking for? If, let's say, factor 1, letter A, weekly quarantine, is our top priority of data. What is it that we're looking for? What are the trigger points that change the behavior or change requirements?
I think we need to look at not just because you have to remember when kids are wearing, everyone is wearing a mask, the number that we are going to initially get, we hope that it won't be very high in comparison to some other local schools who just opened up without masks. So I think it'll be important to see what our numbers are and what our local numbers are.
Yeah, but I'm specifically asking, I'm just using this as an example, is if we decide, if the board decides that that's the most important one, then what are the numbers? So that I'm trying to give the administration a sliding scale to work in, and so that they can predict what they're going to need to do, because we haven't even talked about what we do if we have a lot of quarantined children.
So last year, during our worst week of quarantine, we had over 88 students at one point in the winter months that were quarantined at once. That discussion then triggered a change over the holiday break of how we would do schooling for 2 weeks. And that was the highest number we ever had. Anything under that, we were operating in person. We also offered an online option, but we were operating in person.
And that was across all schools.
The only thing that I would, that I had mentioned before that would be helpful in factors for review is just looking at like the districts that have in our region that have gone both mask optional, mask required as far as the quarantine numbers, I think, and I know you get.
You'll have those weekly, like, I share those with you on that report, I think on the 4th page every week. So everybody around us and the large suburban schools in the area, I always report out to you, but any contiguous district, whether it's Deer Park, Madera, Marymount, you have those every week.
I just, and the reason I asked that question, Nancy, is I think that's something that I personally would look at as well.
Yeah, I agree. Add that to the list, and I would add some comparison school districts that are also doing mask mandate to see what they're doing. So I'd like to see all of it. So Wyoming and Seven Hills, Country Day, those kind of, Country Day would be a really good one too.
So last, again, I don't want to interrupt. It looked like Nancy, you were going to say something. Okay.
No, I was just.
These 5 items, they're not rank ordered, even though I numbered them, but we did look at all of these factors last year, and if you're saying we're going to continue to look at all of them, along with the contiguous district date numbers each week, I will add that, and then, again, if there's any other direction you want to give us on terms of thresholds, that will help, but otherwise, these are the things that we were looking at.
Can I ask a question of the board members? It seems to me that this is such a high stakes issue that we probably should meet and discuss the data, because we can't do anything out of board meeting. We only have to do it in front of the public. So the discussion of all of this information in 2 weeks to decide whether we're going to make a change, because that has been proposed to do it in 2 weeks, I think we're going to have to sit down where we can all talk.
I agree that in 2 weeks, we need to meet in person and talk, but I don't want to be meeting every 2 weeks. What we need to do is give the administration their guardrails and their ability. They need to run the school district. That's their job. It's not our job to come in and micromanage. I do agree that in 2 weeks, if we're starting with masks, we need to meet and talk about it. But beyond that, I'm hoping that we can have a process and a system, because we're in the business of education, and that's what our administrators need to be doing.
So what I've heard, again, is if we were to meet on the 30th or 31st of August for a biweekly review, I think it would be important to clear up for the public. Are we then going to evaluate after 2 weeks, or are we just going to have a dialogue, or are we going to continue to communicate that we will not evaluate until September 14th? And I think we need to clear that up.
And I think that's when we have our vote, when we amend the policy. A little bit later, we can clarify that. But personally, I think we need to evaluate in 2 weeks, not just talk about it. But not every 2 weeks. Is that what you're asking?
It sounds like, yeah, you're saying that we should meet and evaluate in 2 weeks, which would be on or around the 30th of August, and I'm not hearing whether everybody else wants to go along with that or not. But that's one of the questions we need to clear up.
Okay.
That was asked. I think you brought that up earlier.
Okay.
So I'll move on, and you can come back to that if you'd like. So when and where masks are required based on the current policy. Masks are required inside all school buildings for all students, staff, and visitors until September 14, unless that is amended. On all school bus transportation through September 13 until we get more clarification on that federal order. Inside during any calendar of activities or events as visitors or spectators, that's in places like the auditorium, gymnasium, cafeteria, or classroom meeting settings. Masking and social distance will be encouraged and communicated during indoor events, sports, and activities. Citizens should be used to hearing those announcements.
If we're going to meet on the 14th as a board, the 13th is the day before. I would think you'd want to have that masking policy not change until we met.
That's a federal law.
I understand why you did it, but I think it leaves some confusion of what happens on the morning of the 14th. We haven't met, and
I think what they have done, Dr. Hooker, is they have shared 1 week prior to the expiration of those orders each time, and I think we'll probably have to communicate out before the 13th anyways. So that's information I could share to all of you,
okay.
And then we could make sure we put that in an updated release to the community.
And if we've met 2 weeks prior, we'll have had that discussion as well.
Okay.
Next would be when and where masks are not required. Again, we have not said that masks are required outdoors. I hope that that's clear. Participation by students and staff in already approved school activities or events indoors related to the practice or competition times during performing arts and or physical activities such as phys ed, choir, gym, dance, and sporting contests. Again, those are approved. This is the same discussion we had a few moments ago. This is consistent with what we did throughout the school year last year. Masks would not be required of visitors at any outdoor venue. Teachers may at times remove their masks when it is educationally necessary as part of their specialized role, such as speech and language therapy. This is something we practiced last year. We leave it to our professional educators to use their common sense about when they need to do this in an academic setting where it's required. When no students are present during, before, or after school hours, we ask that staff be able to remove masks for adult meeting purposes, and I think this is a point that probably requires a little dialogue and clarification. I know a couple board members had questions about it.
Kim?
And my question about it is, when we talk about sending out the questionnaire to students, we would also talk about sending the questionnaire out to our staff. And I would ask that this would be, I mean, my thought is that this would be similar to, you know, if someone is vaccinated, they certainly can take off their masks around other, you know, vaccinated people. But if someone's unvaccinated, we would encourage them to put a mask on.
Correct. They're welcome to wear the mask.
Kim, I'd really like that. That's what I was going to say. We need to add that in. Unless you're unvaccinated, if you are unvaccinated, you're encouraged to wear a mask.
And we communicated this to all of our faculty and staff last spring. We can reiterate all of that.
Just add that wording.
I have a question on point 4, where a teacher may at times remove their mask for educational purposes. What about our young children, and at times when they need to remove their mask so the teacher can see they're sounding out words, phonics, forming words? How do we deal with that?
Actually, probably I can clear up that language and add that line in for the student, because quite frankly, that's what would happen with speech and language therapy. Both would unmask at different times. So to clarify it,
Yep.
I should add student there.
Okay,
That's
and
great.
is that
Or
just,
staff, because there could be an aide involved.
right, is that just during therapy, or is that during instructional time in the classroom?
Can you say that again?
Yeah, is that just during a therapy session, or is this
No, it could
for
be
inside the classroom
It could
instruction?
be an academic environment required by.
Don't you think the wording would make
Yeah.
it so you could do educationally necessary?
Right.
That leave it to our
I think
professional
broaden it up a
teachers.
bit, yeah.
Speech and language therapy is just one example.
Right, yeah.
Good.
Maybe
And
broaden it up
our
a bit.
board policy allows for academic environments to occur, you know, as a part of the policy.
Okay, great.
Cool.
Contact tracing, again, everybody is so excited about contact tracing, as always, in quarantine. ODH has updated the guidelines. This is a little bit different than last year, and we've already had several questions about this, of course. So again, we'll go through some of this in the following slides, but what you will hear us say over and over again is unmasked and unvaccinated is automatic quarantine. Everything else we would discuss case-by-case basis, depending on social distance, duration. But if you are unmasked and unvaccinated, by law, you would be included in the contact trace and be expected to quarantine.
So I just want to clarify, unmasked and unvaccinated, not one or the other.
Other scenarios are up for discussion.
So unmasked and vaccinated?
You could be exempted.
Okay.
We are going to talk about some social emotional resources here in just a moment. Again, we're going to continue to track these things weekly. We also have to continue to communicate out about reported cases legally, which we've continued, you know, throughout the last year and a half. And I think some people saw we had one reported case. We sent out our first release of the year last week. We're going to continue to promote vaccination as an opportunity. This isn't a political stance. It's an opportunity people can consider. And again, it exempts people from quarantine if they're vaccinated. We're also going to be supportive of vaccinated individuals who choose to continue to wear face coverings to help mitigate anything with regards to contact tracing. We've set up 2 additional mobile vaccine clinics we'll be offering here on site by the tennis parking lots on the 18th and 23rd. We'll be sending information out about that again. And I would encourage anybody over 12 who has not considered vaccination to think about contact tracing and quarantine again in our school year. I want students in school and able to participate.
Do we need to add the word fully vaccinated?
Well, that is what we followed last year. Fully
Okay, well, just
vaccinated,
because
14
it
days
matters.
after, yeah, we
Okay.
can restate that. So again, unmasked and unvaccinated equals automatic quarantine. How do you become exempted from quarantine or from being considered a close contact? Again, there are protocols we follow through ODH. I'm not going to read through all of this here, except to say we're going to continue to pay attention to whether people are getting tested or not. There are rules to follow with symptoms, whether you're symptomatic or asymptomatic. There are rules to follow if you've already had COVID and you're recovering, and whether you're fully vaccinated or not. And again, when in doubt, somebody who has had close contact with someone with less than 3 feet for more than 15 minutes cumulative duration, that's a problem. And we're going to go through those situations whenever they come up for all children and adults on site at any activity, including activities, performances, sports that occur outdoors as well.
Can I have a clarification? So we're talking about close contact, unmasked, and unvaccinated equals automatic quarantine. So why do we need to be concerned about fully vaccinated individuals?
That's just in here so that people understand how we go through the protocols overall. Obviously, if you're a fully vaccinated individual, we ask that you monitor symptoms.
Okay.
Everybody has heard of the possibility of a breakthrough case, and so that's one of the reasons that's still included there. And again, it's recommended that those people consider masking. We have a requirement here, but in other environments, maybe they don't. So it's just restating how the guidelines are shared by ODH.
Okay, so this is more about contact tracing than specifically
Yeah, how
about
we would go
quarantining?
through each scenario to kind of break out our group.
Okay. Okay, thanks. Just wanted to clarify.
Good question. Obviously, if you're exempted from quarantine, you're going to be able to continue to attend school in person. And what we have to do as a district is document that we have our prevention policies in place when we share information to Hamilton County Health. That's really what this slide is about. And that we're sharing that the people who were either involved in the contact tracing or not involved, how we went about determining that. And it comes back to, again, where we have less than 3 feet of social distance and a duration of more than 15 minutes, chances are that is the group of people we're going to start contact tracing, and then we exempt them based on whether they had those other pieces in place like vaccination or masking.
So as I understand it, you start there, and then if we are under universal masking and somebody is wearing a mask, they don't have to quarantine.
Yes, and so let's talk about the elementary school cafeteria as an example. We do not have barriers on the tables because we have 8 children sitting at a table in the cafeteria at the elementary school this year. That is different than last year. Some people say, well, why didn't you put a barrier on the table? Really, if you think about it, each bench has 2 students who are sitting together, and they're allowed to remove their mask to eat lunch. However, they're going to be probably sitting less than 3 feet apart, and they may be doing that for more than 15 minutes with a mask off. They would automatically be involved in contact tracing. If they put their mask on when they're not eating, they may not be. The barrier will not be the difference. Does that make sense?
Will kids have the option of eating outside, like if they would like to go out?
Yeah, there are other options for people who want a different space or setup. We still have outdoor classrooms, and again, we deal with those things on a case-by-case request. I think our principals and teachers did a pretty good job of managing that last year.
Absolutely.
Yeah, I think it's nice if we can offer that an option. Today, I think I just heard the range, so that probably wouldn't work necessarily.
So, Erica, would you want to just talk for a moment about some of our partnerships, just so everybody can be aware of what we're looking at here?
Sure. So
Thank you.
as in, closer? Just like in all other years, we have a partnership with Cincinnati Children's Hospital to provide school-based mental health services. So lots of our kids take advantage of that. Each of our buildings has a therapist on staff 5 days a week. Parents would just need to reach out to their child's school counselor to take advantage of those. We also partner with organizations called Mind Peace and 1 in 5. Both provide us with access to various resources in the region, the most up-to-date research about mental health for children and adolescents. We also meet regularly with other schools in the area to talk about what other schools are doing to support mental health for their students. And then finally, we've developed as a district the Brave Character Education Program at the direction of the board. So that's based on social emotional learning standards and is another layer of support that all students K through 12 are guaranteed.
Can I ask you a question? If a, let's say, 11th grader, or pick anything, 6th grader said, I feel I need to talk to the therapist, do they have to have parental permission, or can they talk to the therapist on their own, knock, knock, I need an appointment?
So there is a referral process that would go through our counseling office where we would be contacting a parent before doing therapy through Cincinnati Children's. But if a student said, I need to talk with someone, their school counselor would obviously be the very first person they would see, and that person would respond to whatever the immediate need might be.
Okay, thank you.
So one more question. So if a student wants to see a therapist, but not for a therapy, just want a consultation, can they do it without parents' consent, or they would still need a parent consent?
Just to clarify, you're speaking about our Cincinnati Children's therapist,
Yes.
correct?
Yes.
So that all goes through Cincinnati Children's Hospital, and I do believe that they would need to get parent consent before they started.
We do have a nurse from Cincinnati Children on a campus, right?
We do. We have a nurse practitioner that she comes, I think, once a month to do if students are in need of medication or things like that, so that students don't have to go off campus for those types of appointments.
Okay, but do we have someone that if a student is feeling restless, or a student has a concern that they want to talk to privately, do we have someone that they can just go and talk to?
Yeah, our school counselors are always available for that
For that.
purpose.
Okay.
Yep.
Thank you.
Thanks, Erica. In terms of daily operations, board members, again, we've had some general questions from the public about what we would do, obviously, with the reopening of school. So I just want to restate here what happens. In the event that we have students who choose to not wear masks in spaces where masks are required, we're going to follow appropriate responses that could include things like offering the child a mask to wear, holding an individual meeting with a trusted staff member, making a phone call home to include parents in the conversation, isolation within a school environment in a space with increased mitigation measures in place for their safety, meeting with the building administrator or principals, requesting a parent to pick a child up who doesn't want to participate. Our district has a legal ability to control our physical campus to keep schools open, and that's our priority.
And this mirrors our dress code policy, is that accurate? Similar to the way we would handle...
Similar to what you would see in a dress code language or policy, yeah. Thank you. We're going to continue to put our mitigation strategies in place. We've got signs posted around campus about our safety protocols. We're going to continue to ask our faculty and staff to maintain classrooms and shared spaces that maximize physical distance to the greatest extent possible, including outdoor spaces. We're going to encourage the use of those same outdoor spaces that we did last year. Our teachers did a fabulous job, as did our students, with managing this. We're going to continue to supply hand sanitizer and continue our hand hygiene practices. We're going to continue to clean and disinfect our facilities regularly with our partners Scarlet and Gray. We're going to continue to monitor, use, and maintain our HVAC and HEPA filtration systems. Again, we have those available for all of our classroom environments to ensure the proper flow and air quality. We're going to continue to partner with Hamilton County Health to perform contact tracing in combination with those isolation and quarantine practices, and we're going to hope we don't have much of that. We're going to continue to report cases found in our buildings publicly because it is law, not because we are trying to just share that information. It is the law. And we're going to continue to limit students on bus seats whenever possible. We were able to have a high level of success with that last year as well. And while students have to be in a closer proximity on buses to and from school, that was not the source of our contact tracing issues most times last year, and I think we were pretty confident that we did a good job with that.
Don't we perform the contact tracing ourselves We don't depend on Hamilton County to do it, is that right?
Well, we do depend on Hamilton County to help us report through their contact tracer
No,
and verify our information, but we investigate on site.
Great, because Hamilton County's going to get overwhelmed, and that's why I want to make sure we're keeping that in-house.
Yeah, we investigate on site, and then we have a liaison that we report to.
And last year, we had an individual that was a contract employee, correct? Who handled it on the day-to-day basis internally?
Last year, that was performed by our nursing staff or administrators on a daily basis, and we have discussed adding a person at the elementary primary level as well as one at the secondary level who we may task with doing contact tracing this year for the team, because as you can imagine, this is a lengthy process when it happens.
Right.
Yep.
We'd like our principals to administer school buildings, not administer contact tracing on a daily basis if possible.
Absolutely.
Absolutely.
And I think our teachers did a great job taking kids out and teaching them outdoor where, you know, they don't even have to wear a mask because they're in an outdoor setting. So that's, I think, a very important part of, it's really commendable for, to say that what a fantastic job our teachers did last year taking students out and keep the education on. So,
Yes, thank you. I don't think that can be restated enough. Our faculty did an amazing job last year of mitigating problems, and they will continue to work to do that as they're building relationships. Thank you. Other future considerations for the board, again, we know vaccine approval is forthcoming for children 12 and under. We expect it to happen this fall. We just don't know when. The best estimates I've been given are late September, early October. We also know that the FDA is slated for formal approval of the 3 vaccines anticipated this fall. That could come as early as the first week of September. The state legislators will be back in office beginning September 7th, I believe, and we'll see what happens with legislation. We're going to continue to get input from Hamilton County health officials and local governing bodies. That evolves weekly, their stances and what they communicate to us. And again, we get those updates by Friday morning every week. And then we know that we can pivot and change our plans if necessary, and we'll continue to share that information with you.
So, I'm pretty sure I know the answer to this, but I'm asking it anyway. The vaccine for children under 12 is still a 2-step process, correct?
As far as I know, if they were to approve Moderna or Pfizer, yeah, and probably Pfizer would be the one.
So we're looking at a 4-week window of vaccinations and then a couple more weeks for efficacy.
Based on what we went through before, yeah.
Okay,
That
so
seems-
6 to 8 week process
Yeah, and I think that,
from the time
again,
they are available.
And that also assumes the supply chain's good,
Well,
Yeah.
that's a big
which is
assumption.
another whole issue.
So I think
Big
if
assumption.
people think about that timeline again, it's another reason to restate why we're going to continue to offer as many vaccine clinics as we can with our partners. And then as soon as we get that approval, we will offer vaccine clinics for those 12 and under, and we will try to offer as many as we can and get that going as efficiently as we can. The last piece here is just, again, in terms of communication out for those paying attention and to review with the board. We're going to continue to ask students and staff who are feeling ill to stay home. That's a counterintuitive message from pre-COVID, but last year we gave this message and we're going to give it again. If you're having symptoms or feeling ill, you should stay home from school. We're going to encourage the continued use of pick-up patrol for the first 4 weeks of school or until the board decides to review that, and ask for people to report daily symptoms. Again, sharing of information is going to help us to talk about vaccine percentages and status moving forward and to mitigate COVID spread. We want to keep people from having to quarantine. We're going to continue to share data reviews with the board each week in the reports, and we're going to continue to review our health partnerships as we go along for evolving news. We will share those updates out with the public as we get them. We're going to continue to report COVID cases we find in our building. We do that within 24 hours of finishing that contact tracing information every time. And we're going to continue to provide vaccine information for children and staff as new opportunities become available. And I would just add a caveat to that. The mobile clinics we're offering with Hamilton County Health on the 18th and 23rd are for children, staff, and any families of Indian Hill that are interested. So any adults interested in the community as well.
Awesome.
This is a graphic just about how some of the guidelines work. We've talked through some of this today, but this will be available for all parents and, again, a part of the release and the information we update on the website today and share. Thank you. I know that was a lot.
Oh, that was wonderful. Thank you for a very excellent packet. So, are there any other questions related to this packet from any of the board members?
There were just one other thing, or two other things, Dr. Hooker, that I would reiterate because of some questions that came up. So one, the question was, could we hold more clinics? Yes, is the answer. Can we ask students, parents, and staff, again, to share vaccine status information? Yes, we can. There is a process with specific language that we would follow under HIPAA. And again, families do not have to offer replies, but we're going to ask those questions. How do we manage groups? Again, we're going to do that on a case-by-case basis when it comes to dealing with our families. And I did have a question again about the review process. So I think the only outstanding questions I heard were what you would like to do with the review and the next time you'd like to do that as a body together that I need to, I guess, hear.
Can I clarify one thing? You were talking about asking the questions with respect to pickup patrol, but also we talked about asking from a staff perspective about vaccination status, which I don't, that's not pickup patrol, right? That's
Staff does pick up patrol.
Oh, they do?
also.
Okay, thank you.
So you're going to basically get a survey together and get it out to all faculty?
Yeah, as long as you have no problems with that, we're going to plan to get that ready for
So
staff and
any
for
board
families.
member have any issue with that?
No, I think that's
I
a
think
great
we're
idea. It will give us a
supportive.
better data and help us make a decision further.
And I think that, at least to me, and maybe other board members would agree or disagree, but to me, knowing that we're getting our vaccine status, the vaccinated higher is going to play into my thought process of what we do in the high school. We may change our mind, and if we've got 95% of our kids vaccinated, that changes the dynamic tremendously. So I really hope that people will get vaccinated and will report it to us so that we know that.
Yeah, great. I agree.
So, not to put you on the spot, but I'm going to put you on the spot anyway. I always love
We're
when
good at
people say that. Yeah, I'm not putting you on the spot, but I am. Given all this information, then as the superintendent, what would you recommend to the board for monitoring and measuring and timing?
I think it's safe to say that I would recommend that we do we continue the weekly reports of data that I share to the board, that the board do a bi-weekly review and evaluate after 2 weeks, because the trends that all of the other organizations share with us are based on 7 and 14 days of trailing data, or which to me, again, is just something we should follow consistently so that we're not getting questions about our own practices. I think it makes sense to do a bi-weekly review and evaluation of the current mandate at that time. So I would say that we should meet on or around August 30th or 31st at the latest to at least evaluate the 2-week trend that started today, because today is the day that our mask requirement went into effect on campus. I also think that we should look at the number of quarantines weekly, which we've been looking at for over a year and a half. Those would be students who had to quarantine because they were part of close contacts. The number of local cases we have. And again, we can break that out by age in our district,
And
by building.
how are you defining local?
Our school district first,
Okay.
our zip code second. And I think we also have to look at our vaccination percentages, because I believe that that is a really a psychological benefit and a celebration for everyone in our school community moving forward. And I think if we feel good about low quarantine numbers, low number of cases, and higher percentages of vaccination, we then should be able to exempt people from wearing a mask. That would be my recommendation.
So my question about timing, given the fact students aren't coming back to school, everyone, until next Monday, and we have 50% Thursday, 50% Friday, I really do think that we need 2 weeks of data. So I would recommend we meet the week after Labor, basically the week that Labor Day falls on. So not on Labor Day, obviously, but the week of the 6th, because I think if we meet on the 30th or 31st, we really only have 1 full week of data that that everybody's in school.
But aren't students here this week for Bridges and
Half and half.
Yeah,
Meet
it
the
is
teacher
like small
and-
number of kids are in
and
there,
all
right?
and parents, families are a lot more on campus this week too? So I think there is a lot of activity on campus.
Part of the reason I'm giving this rationale, Kim, again, and you can disagree, part of the reason I'm giving the rationale is we have so many events and things going on with students and staff already back that started last Friday. I know we don't have a full contingent of a student body in until the 23rd, but we do have staff and students in the buildings every day already this week. And to your point earlier, we're also going to see contiguous data numbers by the time we get to the 30th or 31st. And again, that's 9 full days of a full body in school with staff. I think we'll have some data that would be important. To me, it's up to you all, but that's why I gave that rationale.
I like the earlier date as well for a lot of reasons. I think people on, both sides of the issue of masking in particular, I think having those numbers in our discussion sooner than later will alleviate concerns. I think everybody is looking for data that we will use, and obviously not being back on campus until Friday, last Friday. We just didn't have our true local data to use. So I don't mind having a meeting in 2 weeks to evaluate, and if at that point we don't have enough data, then that's part of the evaluation. But I think the administration is looking for some support and guidance from us sooner than later, and I think the community also wants input as soon as possible. So I don't have a problem with, and if we have to meet 2 weeks after that or the next week, so be it.
2 weeks after that will be our regular meeting. Can I ask a question on this? The data that we get from CCTST, that comes out on Thursdays, is that right?
It comes out, I believe they have review meetings Wednesdays and Thursdays, and then it gets relayed to us on Friday mornings.
So we really will only have 1 week of data as far as infections. We'll have quarantine data for 9 days. You're absolutely right.
Yeah.
I'm not sure that's enough to make a decision on. That's my only concern, like Mrs. Lewis.
Yeah, and again, it's up to the 4 of you. I think, to Nancy's point, people are looking for guidance and information, and in a vacuum, I think more information rather than less, even if you don't change your minds, is probably a good thing. At a 2-week interval, that's what I would recommend.
So, Ms. Lewis, what did you can say?
Yeah, I think we can, I don't know about Mrs. Johnston's schedule or whatever, but I think we can try to talk about it, people's availability that week.
Okay. Sounds good. Any other questions for administration about the packet?
Maybe, I think it's important, we don't have to get into too much detail right now, but maybe Dr. Stewart could just explain, because people are getting confused, the difference between Brave Virtual Academy last year and what a virtual learning opportunity could look like. I just think it's important, and we're going to be sharing information out to the public about this week, because the numbers are much different than last year, and it is a different looking opportunity, and it has a different label.
Thank you. Can you hear me okay?
Yeah.
So, though it was not perfect last year, I have to say we were really proud of what we did in Brave Virtual Academy. And it worked out really well, because in some grade levels, we had up to 40% of our students say that they could not come to school. And when you have that many students say they can't come to school, just mathematically, it makes sense that you can then remove teachers from their face-to-face setting and ask them to be responsible for those students who are online. This year, we do not have those numbers. And so it's really important that we do differentiate, and that we do not by mistake use the term that we are offering a Brave Virtual Academy this year, which in some ways, last year was like a 5th school in many ways. We offered a 5th school of learning. To pull that off, we needed more than 25 staff members who could teach in that way. This year, for virtual learning opportunities, we have 1 staff member, and it's Dr. Kim Given. That's who's basically running it by collaborating with teachers who will offer a VLO. For students to be involved in a virtual learning opportunity, we're taking it by a case-by-case basis, and those students work with Dr. Kim Given and each of the principals to determine how we can make sure to offer a virtual opportunity for the students in a safe way. And we're doing that based on a medical condition that's documented to show that they cannot be in school. When we make those plans, it consists of some live streaming in the classroom. It also consists of some asynchronous opportunities at home, as well as a small portion of their time with one-to-one opportunities in a live stream, live virtual setting with a teacher. So it looks very different from last year's Brave Virtual Academy. And I do feel like it's very important for people to understand the difference. I've had a great conversation with someone recently who asked, why can't we just lift up BVA again? And we would be looking at extreme circumstances in order to do that, not only in the number of students, but also looking at trying to hire staff at the very last minute, which this is Indian Hills School District, and we expect quality. We want people that we have vetted with all of the standards that we usually do for any of our new employees.
Can I ask a question? How will we handle, because I think parents are going to ask this, my child just got exposed and they're now in quarantine for the next 10 days or 14 days. How will we handle continuing their education? What will the teachers be doing?
The same as we did last year, the teachers will be expected to have information loaded onto our learning management systems. At the primary and elementary, it's Google Classroom. We use Canvas at the middle school and high school, and the information will be posted on there, and students will participate in that way.
Okay. Thank you. I just wanted that to be clear.
Thank you, Dr. Stewart. And that was the question I was going to ask you to clarify. I appreciate it. Thank you very much. So that's really all we have to share at this time, board members.
All right.
I just want to make a point. I think because now we don't have BVA, it is even more important that we have students in the building and less kids getting infected.
Yeah, I agree with you. Mrs. Lewis?
Yeah, I know that, you know, the mask policy that we have in writing is something that we'll need to make a motion to amend the agenda, and I know that we have had discussions about the time period. I just, you know, and I think that that's kind of the next order of business.
Yes.
But before I do that, I did want to make sure that the board was aware. I will not be able to make a meeting that week, and that's fine. If you have enough members beyond me, I will be available the following week. But I know that we have to have a policy in place, you know, until you have a quorum that can make it there. So I wanted to make sure that I was clear that I
Yeah,
can't
thank you.
Yeah, absolutely. So I would entertain a motion to amend the agenda.
So moved.
Second.
And tell me how you're going to amend the agenda, please.
Sorry.
Well, don't we just have to pass we have to first pass the fact that we're going to amend it?
That's what I said.
Okay.
Just so do you want to amend the
Well, I
agenda?
think we need to vote on motion to amend first.
Right.
Okay.
Yeah, that we are
All
amending
right.
it.
So
So we're ready for a vote.
all those in favor of amending the agenda? Aye.
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 Do we need a roll call?
We need a roll call on that,
Okay.
Dr. Hooker.
Thank you.
Mrs. Singh, were you the second on that?
Yes.
Yes.
Thank you. Mrs. Lewis?
Aye.
Mrs. Singh?
Aye.
Mrs. Eichholz?
Aye.
Dr. Hooker?
Aye. Now,
Well, and I think this is one that I don't know that, I guess I should make the motion and then we have the discussion. But I would make the motion to, and I apologize, it's in here somewhere, the specific mask mandate, if you can help me
policy.
find it. Thank you. In our materials, there is a use of face mask coverings. Yes. Which is what has been presented, and I would make a motion that we approve this as we've discussed. And the only question, I would make the motion that we approve it as is through the August 14th, have a meeting to see whether
No,
India.
you said it's August. You meant September 14th.
I've lost, thank you.
No problem.
Through the original date of September 14th, but that you have a meeting to discuss amending it at a prior point in time. So I would make a motion to approve the use of face mask coverings through September 14th.
Based
So-
on
so you're
the
saying-
written thing.
I guess we need a second, and then we can discuss.
Do we have a second?
Second.
Okay,
So-
now,
Okay, so you're saying approve through September 14th. So even if we have a meeting on August 31st, all we can do is evaluate, we can't make any changes?
No, you
We can
can
always
amend
make a
it.
change.
You can amend it.
Yeah, we can amend it anytime.
so what's
As long as the board is together, we can amend it.
Okay, so what's the purpose of the 9/14 date then?
Because that was it's really the original date, to have something in effect. And obviously, the board can amend it at any point in time.
Okay, so what's different about 9/14 then? I guess I'm tripping over that a little bit.
Maybe it's, I think
I
it's,
think what we are saying is that we will reevaluate it, but not necessarily that it will change it. That time, it will depend on what the data we have and how we vote
okay, but-
about it.
maybe I
Yeah.
misstated it because I made,
Yeah.
it's really just approving what we approved on August 3rd. But it's now kind of in writing in a clear form. And I wasn't changing the date. I was just seeking to clarify because we had a discussion about maybe amending it prior to that point in time based on further information. And I think that, at least I think I've heard the board is willing to talk about those things based on data and amending it prior to that point in time.
Okay, as long as we can, on August 31st or 30th, actually amend the policy.
You have the ability, because of the way the policy and guidelines are written, to do that at any time.
Yeah.
Okay, I think it's just confusing to put a date in there, because what does it mean?
And that language is in the guidelines, the date, but you can amend it at any time when you make a motion.
Okay.
Okay. Thank you for clarifying that, Nancy. Is there any further discussion on this? I would therefore call for the question. Roll call, please.
Mrs. Lewis,
Aye.
Mrs. Singh,
Aye.
Mrs. Eichholz,
No?
Dr. Hooker.
Aye. And we now have, do I have anybody who would like to allow for anything else at this work session?
What is
Right,
it?
Holtz, or
Excuse me?
do you want to make any motion to allow public commentary or anything?
I move to allow public commentary.
Can I have a second, please?
Second.
All those in favor?
Can I ask a clarification question?
Yes.
The time of public commentary under our board policy is how much?
30 minutes.
30 minutes.
And a limit of 5 minutes per person.
What's your timing?
That'll break my time, so that's fine.
Okay.
Okay,
Thank you very much.
so we need to vote. Is that a roll call?
Yes, please.
Mrs. Eichholz,
Aye.
Mrs. Singh,
Aye.
Mrs. Lewis,
Aye.
Dr. Hooker.
Aye. So, Mr. Davis, would you take care of running the show at this moment?
Certainly. We'll have 30 minutes of public participation. I will do just as I did at the Tuesday meeting. I will call up 3 members, and then I would like for you to sort of get in line over there by Mr. Nichols. The first person will begin to speak. I will call up an additional person who will be the third person in line. Please, as I call you forward, come forward, get in line. Please remember that we are a civil body here and that we should respect all viewpoints and keep all clapping and participation in the audience to a minimum. So with that, I would like to call Nicole Isgrig, Katie Foster, Jerry Wentz, and Melissa Chen will be the first 4.
So Davis, can I ask you, so the emails that we receive from the parents, are we reading those, or how is it going to be?
So we asked for emails to be sent to the board office, to me in particular. We will not be reading those publicly today. Those were all given to the Board of Education. I had nearly 42 pages in a document. Those were distributed to the board members for them to read and then also to be included in the minutes of this meeting.
Yes, and the board has read those. Every board member has read those, so we just, to read them in at this point would be wasting a lot of time. As you step forward, come ahead and just introduce yourself because this is being recorded.
Nicole Isgrig.
So,
And would we possibly be able to allow people who are speaking to take their masks off to speak? Because it is hard from over here to hear them speak. Any major objection to that? Okay, that's fine. Just speak, get very close to the mic. That's what
All
my
right,
kids
go
would say.
ahead,
too.
please. Thank you.
Yeah.
Hello.
Hi.
I feel like this is a futile attempt, but I will proceed anyway. I'm going to begin with data directly sourced
Could you
from the CDC.
tell us your name, please?
I'm sorry, my name is Nicole Laskrig. I'm the mother of a junior and an 8th grader here. I'm going to begin with data directly sourced from the CDC. During this pandemic in the United States, as of August 11, 2021, 52,600 children under the age of 18 have died of all causes. Of those 52,672 deaths, 354 died involving COVID, almost all with comorbidities. Fewer kids died of COVID-19 than heart disease, cancer, suicide, homicide, and birth defects, which killed hundreds of times more. Why are we masking kids? They don't easily spread to adults. They are not effective vectors, and they are very resistant to COVID. In the last 4 decades, there are 0 randomized controlled trials concluding that masks stop the spread of upper respiratory infections. 0. Any data that proves this wrong, please provide it. The flu poses a far greater pediatric threat than COVID. In the 2018-2019 season alone, almost 1,000 pediatric flu deaths were recorded. To be clear, a typical flu season runs October through May. Based on these numbers alone, we should be masking every flu season. How ridiculous is that? A May 2020 meta-study on pandemic influenza published by the United States CDC found that masks had 0 effect, neither as personal protective equipment nor as a source control. An article in the New England Journal of Medicine from May 2020 came to the conclusion that face masks offer little to no protection in everyday life. A 2015 study in the British Medical Journal found that cloth masks were penetrated by 97% of particles and may increase infection risk by retaining moisture or repeated use. This is exactly what's going on with the kids they're reusing these over and over. We know they're moist. We know they're dropping them on the floor. We know they're touching them. We know that that's occurring. The WHO admitted to the BBC that its June 2020 mask policy update was due not to new evidence, but to political lobbying. Dr. Hooker, you stated on August 10th that cases were up 400% in the last month. My question is 400% of what? These percentages are the easiest scaremongering tactic taken directly from the mainstream media's playbook. This brings me to the infection fatality ratio versus the case fatality ratio, and whether most know the difference. Spend your time researching that in regard to COVID-19 and the flu, instead of looking at death numbers supplied 24/7 by the media. If more people devoted their time to researching the data that is so easy to find versus putting their blind faith into the mainstream narrative, myself and other parents wouldn't have to be speaking to school boards. Just because the media reports it doesn't mean it's true, but sadly so many people believe it like it's the gospel. Dr. Lucy McBride is a practicing internist in Washington, D.C. She says, quote, "Fragmentary data and muddled messaging from the CDC and elsewhere have stoked the public's collective fear, especially among parents. The Delta surge has created new opportunities for grifters, anti-vaxxers, and others to spread misinformation that preys on parental anxiety. Not all fear is irrational. We need it to survive. However, being constantly wired and dialed into our fears is unhealthy for us and our children." Dr. McBride also states, "Fixating on a single threat to our children's health can keep us from recognizing their broad human needs. Every day we face risks for our children. Every time my 16-year-old drives her car, I worry. But that doesn't stop me from allowing her the freedom and independence she deserves to grow. We as parents truly deserve the choice to do what we think is best for our children. In order.
Time. That's time.
Thank you very much. If you have your written comments, you can handle to Mr. Nichols, and those can be recorded in the minutes. Thank you.
Hand those to where? Oh.
Right behind you. Thank you. Who's next?
Jeff Heineken, please come forward.
Hi, thank you for the opportunity to speak. My name is Katie Foster. We're brand new to the district. I have a 6-year-old son that is medically complex going into kindergarten this year. I am speaking for Daniel Wu, who's the professor of neurology at University of Cincinnati, who's unable to attend this meeting. To the Indian Hill School Board, thank you for the opportunity provided today to air thoughts on the recent decision by the board regarding mask mandates. I'm a professor of neurology and vice chair at the Department of Neurology at the University of Cincinnati with a rising 11th and 8th grader attending school, cross-country, marching band, Latin club, powwow, and choir. My primary concern was echoed by one of the speakers last week, which is the long-term effects of COVID among survivors. A recent JAMA neurology paper found that 20% of over 1,600 pediatric COVID patients suffered from neurologic symptoms, including stroke, Guillain-Barré, and multi-system inflammatory syndrome. The long-term effects on our pediatric population won't be known for decades, but autopsy studies of severe COVID infection demonstrate a 70% rate of blood-brain barrier leakage among the most severely affected. This leakage is the key pathophysiologic event in many forms of progressive cognitive impairment. In developing children, it is difficult to overstate the importance of this well-established scientific and medical fact regarding COVID infection. As stated tonight, it may be true that bodies of politicians, some of whom may be doctors but most aren't, have not mandated masks in many school districts. But physician-led bodies of experts, including the CDC and the American Academy of Pediatrics, recommend masking during the current Delta variant crisis that has seen skyrocketing rates of COVID infection in every state. I won't ask a surgeon to do my taxes for legal advice, and we shouldn't take medical advice from non-medical professionals. It is paradoxical to me that with a less contagious and less severe COVID last year, we had an appropriate and measured stay at home versus in school with masks and appropriately guided levers to turn on and off different mandates. Yet with a more contagious variant, with greater evidence that vaccination may be asymptomatic carriers, and without the ability to achieve herd immunity within the state of Ohio, which still is under 50% fully vaccinated, that we are seeking to end a sensible and measured restrictions when things are bad and lifting, when things are getting better policy. The rates quoted last week are evidence of the success of such measures with very few children dying across the state of Ohio. One doesn't get rid of the parachute halfway down because it's working. Much damage was done to the cause of civility by the laughter at the suffering of a mother whose family has seen firsthand long-term effects of COVID. There was absolutely no laughter or snide bickering when the mass choice side gave their heartfelt side. Please do not view that small contingent of vocal parents last week as reflecting the mood of thousands of parents throughout this community, nor should such duty to responsibility be subject to the mood, and if I heard correctly, threats of the mob. People used to argue that they had the right to drink and drive. They have the right to drink in the privacy of their own home, but others have the right not to be endangered by their behavior on a public road. People used to argue that they have the right to smoke wherever they wanted. They have the right to smoke in their own home as much as they want, but others in enclosed public spaces have the right not to be exposed to danger from their smoke. Here too, people have the right not to vaccinate or wear masks and decide for their children. No one is taking that away from them, and if anything, every accommodation is being made for them. But in public spaces and schools, others have the right not to be exposed to the dangers of those behaviors. At least during this current spike, nearly as bad as the worst of the pandemic last year, we should be temporarily cautious and let events and science dictate how we raise those restrictions, hopefully soon. My kids are vaccinated, as are my wife and I. I do believe that if we can bear through these difficult times, that they will end quicker. But if we delay and delay the correct measures, these difficult times will linger for years and years. I thank you for taking the time to read my thoughts and for your thoughtful and responsible service to our community and especially our children.
Thank you very much. And if you want to hand it to Mr. Nichols, he can
Thank you.
have it.
Chris Flaska, please come forward.
Chris, I know he just said your name, but please state your name as you start.
Okay. I did have a question to ask regarding how this works, if that's okay. I don't know if I'm using my time. Even though I have a few pages, it's awfully large print so that I'll be able to see it. And I only plan on talking for 2 minutes. And so my question is, can I give Nicole, who
No.
didn't get to finish?
No.
Okay.
Thank you, though, but appreciate it.
Right, am I on the clock? Okay. Good morning. My name is Jerry Wentz, and I want to start with saying something that I hadn't planned on saying, which is I wanted to apologize to Kim Lewis because I view the mental health aspect different than the way she described it this morning. So I have something prepared, and if I refer to mental health, if I offend anybody in any way, it's only because I'm scared to death about it. And I'm not trying to say anything offensive to anybody, and I hope that you know that. I've lived in Indian Hills School District for 24 years. I have 3 children. My youngest is a senior this year. As I was preparing for today, I was thinking of all the things I wanted to say. Please don't ruin my son's senior year. I am legitimately scared for the mental health of all Indian Hill students. We've always had immune-compromised children in our school districts, and we've always had the flu, and we've never had a mask mandate, and the flu is more deadly. Why do some people proposing masks only put them on when they're trying to create fear? Why are they twisting the data to make things sound worse than it is? My example is Nikki's example of the Duke study, which only studied children in masks. Why is the school board micromanaging our superintendent? Why don't they listen to our teachers who are the heartbeat of the schools? What the heck happened to my body, my choice? And while I'm thinking about it, since when do I need somebody else's permission to parent my child? All of these thoughts were immediately followed by the visual of our school board president raising his voice and talking down to nearly more than half the auditorium. An audience of his neighbors, his peers, some of whom voted him into office. At that point, I better understood why the Rangers were called to the last meeting, and I realized that all this back and forth, everybody's opinion has legitimate concerns, is getting us nowhere. So back to the beginning. How can we come together as a community? How do we find a middle ground? Mask, no mask. Mask, no mask. Seems to me the compromise between mask and no mask is mask optional. Seems like our teachers in Kirk were onto something. But what do they know that we've forgotten? They probably are thinking about the fact that our children are good citizens. Our teachers are good citizens. Everybody in this school district is a good citizen. And the example that comes to my mind is when I remember the class of 2016 voting Abby Favell, a girl with Down syndrome, as their prom queen. It made Abby feel like the rock star that she truly is, and our children redefined the word special that night. So here's my final thought. Instead of enforcing a policy that has zero conclusive data to support it, What if we just trusted each other, our kids, our teachers, and our superintendent? When I think of the word optional, I think of room to breathe and not scolding children because they're not perfect and they need just some fresh air. Thank you.
Thank you very much.
Would Jeb Lyons please come forward?
And again, please state your name as you start. Thank you.
So my name is Melissa Chen. I am a resident of this district. It was my understanding that what you wanted to hear from more than opinions or the vast information that we can all find to cite our different sides on the internet, what a lovely place, is that you wanted to hear from pediatricians, of which I am not, but I will use this time to read a letter, rather, from Dr. Andrea Rinderknecht, who is a pediatrician in our district. Dear members of the school board, thank you for your service to our schools, our community, our children. It cannot be easy to be asked to make decisions that affect so many people, especially when the decisions hinge on information that might not be in your area of expertise, and when the constituents you serve have such polar opposite opinions and strong emotions to go along with them. We all want this pandemic to be over. Nobody wants to wear a mask if it is not necessary. But this pandemic is not yet over, and we all must work together to keep each other safe until it is. That means doing things that are inconvenient, uncomfortable, for the safety not just for ourselves, but of all our children and of each other. My plea is to take the emotion and politics out of the decisions about school-based pandemic safety protocols and listen to the professionals who have spent their lives learning about science, practicing medicine, and how to evaluate sources and interpret data streams for accuracy and bias, and who for their whole adult lives, and especially during this pandemic, have given of themselves and put their own lives and families at risk to care for their patients, our children, our friends, our communities. I'm writing to you as the parent of 2 Indian Hill students, one who is immunized against COVID and one who is not yet eligible by age. But more importantly, as a pediatrician, my area of expertise, having practiced over the course of almost 20 years in emergency medicine at Cincinnati Children's Hospital Medical Center, as well as more recently in the community as part of a tri-health pediatrics practice, is the health and safety of children. The following information is based on scientific data, consensus in the medical community, and my personal experience caring for pediatric patients, including from the Indian Hill community throughout the pandemic. I know you must have an overwhelming number of letters to read, so I'll keep this as short as possible. I'd be happy to provide any references should you be interested in supporting sources. I and the overwhelming majority of physicians in our community support universal masking of all students and staff indoors at all levels, but particularly for preschool, elementary, and middle schools, which contain the most at-risk students who are not yet eligible for COVID vaccination. This recommendation is strongly backed by science, including updated guidelines from the CDC, the American Academy of Pediatrics, and Hamilton County Public Health. Masks worn to prevent transmission of COVID-19 are important, scientifically proven mitigation strategies. Masks may not be perfect, but a well-fitting, appropriate mask is without doubt better than no mask for preventing transmission of the virus. Optional masking is not sufficient, as masks are most effective when all parties are wearing them. If masks are not worn by every student and teacher, CDC and HCPH quarantine guidelines will force large numbers of students as well as teachers to quarantine at home. And we all know after last year how different in-person education is compared to self-guided work at home. We all share in the goal of keeping students in school. Masks will undoubtedly help achieve this goal. Without a virtual learning option this coming year, more students will be in each classroom, which means less ability to maintain distance, increasing the importance of masking. Masks also had the added benefit last year of keeping other viral respiratory illnesses at exceptionally low levels. This too kept more kids in school, decreased COVID testing burden, and lessened the stress on families of having to determine if an illness was COVID or not. The COVID-19 Delta variant, now the predominant strain in the United States, is more than 2 times as contagious as previous variants.
Thank you. Thank you very much. And
Yeah, again, that wasn't from me, just specifically Dr. Andrea Rinderneck. Thank you, Dr. Rinderneck.
Thank you.
John Zerby, please come forward.
Ready?
Oh, yeah, just introduce your name.
My name's Jeff Heineken. I'm a parent of children in the Indian Hill School District. You know, I live in a country where I can stand in front of my school board and state my opinions. You may not listen to me, and that's your choice, but as long as I'm respectful and follow the law, I have no fear of what I say. This is going to come as a surprise to a lot of you. I'm going to quote John Kennedy. Let us not be blind to our differences, but let us also direct attention to our common interest and the means by which those differences can be resolved. And if we cannot end now our differences, at least we can help make the world safe for diversity. For in the final analysis, our most basic common link is that we all inhabit this small planet, we all breathe the same air, we all cherish our children's future, and we all are mortal. Now, I firmly believe that the Ohio Revised Code, Title 33, does not give this school board the authority to make health mandates, and therefore the vote on August 3rd, August 10th are without authority and unenforceable. And I'm just beside myself that a certain board member who is an attorney, who has been recognized as Ohio's super lawyer, best lawyers in America, who's for law, has not counseled her colleagues on that effort. I've been asked, what can we do about the vote, which I claim is without authority and unenforceable if it stays in place? My response is, make your own choice for your children. You can choose to have your child come to school without a mask. To my knowledge, there is no mechanism in the school board's policy or the school district's rules to punish anyone for violation of an illegal and unenforceable order. I do not believe they can or will do anything. I do not believe it's within the power or the training of the teachers to enforce improper and illegal actions. Should your child be punished, you will then have a prima facie case for damages, and the school board's qualified immunity will no longer protect them from illegal acts. It's your choice. So, why am I here? Remember my Kennedy quote, let's not be blind to our differences, but let us also direct attention to our common interest. I'm here to offer a compromise, which is to have the school board amend its order to provide for 1 week period of strongly requesting all students wear masks. And at the end of that week, if the average number of new cases per day as reported by the Hamilton County Board does not increase by 20%, parents and students be permitted to make a choice to wear masks. I've prepared a board amendment to that effect, and that's really all I have to say other than, Mick, what I sent you, I have amended, so I'm just going to give this to Mr. Nichols, and thank you.
Thank you, sir. Who's next?
Chris Blaska is next.
Hi there. My name is Chris Flaska. I live in the Indian Hill School District. I find it really disappointing that we just can't have this as a volunteer. You know, no one's outlawing masks. I don't know why we have to mandate it. There's some data that was presented, and the data that I see, it I find positivity rates quite meaningless. I want to know when people are ill, and I don't need to know the positivity rates of anything. That's a meaningless piece of data. There was mention of the flu, or mention about the flu data. Yeah, the same study that someone else referenced, 2018. There was 51,000 kids under 18 in hospitals for the flu, and 480 died. And that was in an 8-month period. And in a year and a half of COVID, that's been half the deaths, most with comorbidities. And Ms. Singh mentioned she's concerned about 1,000 kids in the hospital. Well, there were 51,000 in an 8-month period in 2019. No one on this board was recommending masks in 2019. The CDC also says the recommendations for the flu are to stay home if you're sick, clean your surroundings, and avoid touching your eyes, nose, and face. So I would say that putting masks on kids, they're going to be touching their nose, eyes, and face quite a bit. Also, I would offer that at least the doctor, I'm sure, has been through PPE training. Surgical masks are meant for one-time use, not all-day use. Any mask in surgery or any mask in medical is one-time use. It also does not stop the particle of the coronavirus. The coronavirus particle is, so I'm told, 0.1 micron. Those masks at best will only prevent 0.3. So and you can smell smoke through a mask. That tells you everything you need to know about what they're doing. I guess the last observation is, I came here, I went to the wrong rooms. I saw the cafeteria, I saw the high school gym filled with people. None of them were wearing masks. And that's fine, it's good. I come here, we got you all lined up with masks on. So I find it disingenuous that you think that any of this is meaningful. And as someone mentioned to me, it's to me, it's as an observation, it's this, it's a form of child abuse. There's a disease called Munchausen by proxy, where you project the disease on someone else. Well, I think you're projecting the disease on the kids. So I think you have Munchausen by proxy. You're showing us how much you want somebody else to be sick. And that's my opinion. And I think you need to seriously step back and let people live. Like I said, in this room, in this building alone, there's 100 people running around without masks, and yet you want to mandate it. That's all I have.
Thank you, sir. And again, if you want to give your comments. Where are we at, Nick?
Hey, good morning, everybody. Jeb Lyons.
Hang on 1 second. Where are we?
I don't have 30 minutes.
25. Good. Please go ahead and state your name. And
I just said Jeb Lyons. My wife couldn't be here today, so she asked me to speak. I asked her son last night. I said, buddy, how do you feel about wearing a mask in school? And I used my best poker face, so I wasn't, manipulating his answer at all. He said to me verbatim, I can't breathe and I'm worried I'm going to die. I said, what do you mean? He said, because I have no oxygen. I'm doing my best impersonation. You can sit there and think to yourself, he's not going to die. Breathing in your own exhale all day long is not harmful. I don't care. This is how my 5-year-old feels. And all day long he's worried about his breathing while simultaneously trying to learn. These are his foundation years. It's a major distraction and restricts his teacher's ability to encourage him. That's why these people got into this industry. They all want to teach to get a kid to reach his full potential. I can guarantee you my son is not reaching his full potential. I mean, period. You think you know what's best for him, but you don't. That's just your ego getting in the way. You don't even have kids dealing with this like we are. There's no skin in the game. And telling parents their mental health concerns are garbage is... When my son was in school every day wearing a mask, I would have him read to me at night. Every time he got a word wrong, he beat his head repeatedly. And I don't want to say this in a recording, but I care about him. He's the kindest kid in the world. He would beat his head uncontrollably, like a mental health problem. It was freaking me out and freaking him out too. He said, Dad, what's wrong with me? I mean, I'm not, so if you tell me to my face that my concern is garbage, then you go hang out with your friends without a mask on, you don't even have kids who go here, you can see why so many people are in an uproar, asking you to resign. So my son stopped hitting himself over the summer when he wasn't wearing a mask, even though he still messes up a lot of the words. So I can't prove this mask, mess with his mental health, just like we can't prove the mask does anything to protect the child's physical health. So, I mean, Google it 1,000 times over, it will say, may do something. So that's why the only solution is mask optional. I mean, it's that simple. A good deal is when nobody's truly happy. You say mask optional, you're still gonna have people upset on both sides, but you have to meet in the middle. I would, encourage you to stop being so stubborn and letting your ego think you're saving the world. The news says you are because it's designed to keep you to watch and then sell you products during the commercials. But as my wife said, the teachers, students, parents, and superintendent all vote for mask optional. The majority of you board members already would have if you weren't being bullied in the last meeting. I could see there was a tipping point, and then people just kept getting interrupted. So some parents are concerned about mental health. Others are concerned about physical health. You have to let each family make their own decision. And most importantly, when they do, we can't judge each other. Make a commitment to be a stronger community, to be a good example for your kids. Don't talk under your breath. Don't tell your kids that family doesn't know what they're doing for wearing a mask or not wearing a mask. Respect their decision and be nice to everyone. Mask optional. Thank you for your time.
Thank you, sir. Is that 30 minutes? Okay, we're going to cut that off. I'm sorry. If you have a comment you want to give to Mr. Nichols, he will take it and we will actually read it, okay? We have time for one more? I'm sorry, I thought you said no. Oh, please. Awesome. Come ahead. And just state your name as you start.
Got it. Good morning. My name is John Zerby. Thanks for the opportunity to be here today. I know I'm going to chew into my time here for a second, but I wanted to make an observation that Board Member Acoltz brought to my attention a moment ago when she asked Ms. Foster if she could take her mask off so that we could hear her better. And your response was no, that you wanted to keep your mask on, and that's absolutely your choice. And I think that's exactly a perfect segue into what I want to talk to you guys about this morning. So my wife Amanda and I, we're raising 4 young boys here in Indian Hill. Our oldest, Jack, is 6 years old and a rising first grader in the primary school. I'm here as an advocate for mask optional school year. What's best for one child and what is best for another child does not always have to be mutually exclusive. This does not have to be a zero-sum game. We should all have the opportunity to do what's best for our children. The last 18 months have been tough for everybody. All of us in this room have suffered to some degree. There's been physical suffering and then mental and emotional suffering. If I could just spend a moment to talk about quantitative versus qualitative. Quantitative topics are obviously more easily measured. What can be measured can more easily be understood. We come across quantitative metrics all the time: weather, stock prices, sports scores, and COVID-19 has been no different. Since March of last year, we've had a nonstop feed of this data. Positive cases, hospitalizations, hotspots. We're flooded with this stuff. We can chart it, trend it, and we can even assign color codes to it to compare ourselves to other parts of the country and the world. Data's everywhere. Quantitative metrics are more of a science, and qualitative is more of an art, not as easily measured. Some examples of some rhetorical questions. At what moment did you fall in love with your husband or your wife? How much do you love your children? How was your day? These questions are more difficult to answer with real data. They're not as easily defined. But just because we can't quantify the answers to these questions, it does not mean that the answers are not important. What we're not talking about is the qualitative side of COVID-19. What about the people who are not accounted for in a metric? Board Member Lewis, you talked about illness. What about people who don't show up in an illness metric? What about how our children are feeling? Has anyone bothered to ask them how they're doing? Most of us in this room are adults. We're better equipped than our children to deal with difficult situations. How do we quantify the emotional and mental suffering our children are experiencing? I don't know how to quantify this, but I know it's there in my son, Jack. He's not doing as well as he should be doing. I'll be clear, I'm blessed These issues that I'm describing to you are not necessarily scientific or labeled as an illness, but they're real. The mask acts as a muzzle on him. He told Amanda every day on the way to school last year that he didn't like to speak up because of the mask. He didn't like the way it feels on his lips. What do you tell a 6-year-old who tells you that? Last week when we drove by, we were talking about school and he said he missed it. But he said, "Mom, please don't make me wear a mask." While a certain board member might think that that's a garbage comment, we know it's not. This emotional and mental suffering is very real. It can't be measured by the CDC, but it's real. You should not be mandating masks. This needs to be a choice. We cannot and should not value one child's suffering over another's. This is wrong. We're lucky enough to live in the best school district in Ohio. This board was elected to maintain and build upon that prestige for the benefit of the next generation. You need to do better. We need more balance. A secret emergency meeting on August 3rd with a moment's notice to quickly vote for a mask mandate, that was the easy way out. You need to have the courage to put in the real work and come up with a creative solution that allows all children to thrive and grow. The framework that you laid out, Mr. Konecki, a few moments ago, that's the first thing I've seen that resembles any sort of logic in this process, so thank you for pulling that together. The rushed decision to mandate masks sets us all up for failure. There is no finish line. Whether you want to admit it or not, the risk to our children dying of COVID is so incredibly low. I sent you all an email on August 5th with footnotes and all the data that you need, but you're choosing not to acknowledge it. We need to stop with the cherry-picked data, propaganda, stop reciting incomplete and misleading information to scare people. Cincinnati children's COVID cases rising 400% last month. Compared to what? The prior month, prior year? Did we go from 1 to 5, 1,000 to 5,000? The risk of a child dying from this disease is so low, you know it, but for some reason you're choosing not to acknowledge it. Listen to all your constituents. Please swallow your pride, set aside your emotions, and vote for a mask optional school year. Thank you.
Thank you for your comments. All right. I'm glad that we were able to hear everybody. Is there anything else, or do we have a motion to adjourn? Second?
Second.
All those in favor?
Aye.
Aye.
Exclusive coverage on the Indian Hill Television Network has been a copyrighted presentation of the Indian Hill High School Video Department.